Well, welcome everyone. This is Marianne Snyder, the Director of the Office of Early Childhood. We thank you for taking time out of your day to join us to talk about the new, excuse me, the new resource guide for child care providers during COVID-19. We know providers have faced challenges adapting to the new guidelines and the quickly changing situation we are in. And we want to thank each and every one of you for doing what you do to keep children and families safe in Colorado with your essential work as child care providers. We hope that you find the guide a helpful tool as you think about your day-to-day operations in your child care center or home. We hope this provides you with a high-level overview of the necessary changes to your normal program operations as a result of the pandemic to ensure that children in your care, as well as you and your staff, are safe and healthy. The guide is filled with links to additional resources, so I encourage you to take the time to review the information linked when you want to learn more or need additional detail about a particular topic area. So today, we want to spend the majority of the time answering your questions as we review the guide. We received quite a few questions ahead of time, and many of them will be answered as part of the presentation. And then we'll start working through the rest. We have a panel of experts with us today, so I'd like to ask them to introduce themselves now, and then ask Karen to walk us through the guide. So we have Karen Rosa from the Office of Early Childhood. I guess I should let you all introduce yourself. Go ahead, Karen.
Sure. Good afternoon, everybody. I'm Karen Rosa. I'm the Director of Child Care Licensing for the Office of Early Childhood, Colorado Department of Human Services. Thank you for being here today.
Hello, everyone. This is Amy Gamble. I'm with the Colorado Department of Public Health and Environment.
Hi, everyone. This is Taryn Schneider. I'm the Executive Director at Healthy Child Care Colorado.
Hello, this is Katie Maldonado. I'm one of the CCHC coordinators for Healthy Child Care Colorado.
Thanks, everyone. Karen, you want to kick us off?
Absolutely. Thank you, Marianne. So I'd like to just start out by reiterating Marianne's thoughts about just thanking you all for all of your efforts in supporting the children and families during this pandemic. You know, we can't tell you how much we appreciate you. And like Marianne said, the guide was created to help assist child care programs with the practices and response to the COVID-19 pandemic. I'd also like to let everyone know if you'd like to receive an hour of professional development for today's town hall, you can complete the provided Google form. That's there's a link in that we sent out to everybody, and so if you would like to get that professional development credit, you can fill out that Google form. And if you choose to complete that form today, your certificate for today's event will be available through the Professional Development Information System account by July 21st. So if you don't have the opportunity to do that, or you know people who weren't able to attend today, we will also be providing an upcoming online self-paced course that will walk through the resource guide and a recording of today's webinar on PDIS. So there's additional opportunity there, but I can see the link was sent out. So if you'd like to fill that out today, you will receive your certificate by July 21st. I'm just going to go over a real high-level overview of the guide. I'm not going to go into great detail because really today's webinar is to try to hopefully answer many of your questions as you went through the guide. I'd also like to say if you have any additional questions after today that we didn't get to, please make sure that you can always reach out to your licensing specialist or your local public health agencies to provide additional support and clarification. If you don't mind going to the next slide, please. So the guide was really set up to help providers in their response to practices for COVID-19. And so it's set up kind of how you would set up your program. So if you don't mind going to the next slide, the first set of information we cover is planning your operations. So this covers things like what kind of supplies you'll need, what funding is available, how to set up your classroom composition and your staffing plan, and then protocols for the outbreak. So like Marianne said before, all of the links that are in here go to additional technical assistance and resources. So really, please make sure that you click on the links and go through that information, because there's just a plethora of wonderful information to help assist you in this planning for operations during this time. So after planning for your operations, the next thing would be that before families arrive. So this area covers things like how to communicate to families about steps for preventing the spread of the virus, how to make sure that they are screening their child and themselves for symptoms and staying home if they have any symptoms of COVID. It also includes things like emotional supports and supports for both the family and child's well-being. And then next we go into talking about when families come to drop off at a program. There's great resources here for like maintaining social distancing during drop-off times, assessing children and staff's health prior to attendance, because if they have any of those signs, then that day we don't, we would say don't come to the program. Making sure that staff and children are wearing face coverings, and then also some information about washing hands. So those are some of the things that are covered in the drop-off procedures. We also put in a lot of great resources regarding playtime. So these include things, wonderful ideas. We did a lot of gathering of information with helpful ideas for programs to create social distancing opportunities for kids as they're doing their playtime. Also about how to clean and disinfect frequently touched items and toys and equipment. And then also information about encouraging conversation about the use of face coverings and identifying activities that support children's language and social emotional development. The next area we cover is mealtime, and that includes information for washing staff and children's hands. Also, the child and adult care food program is a really wonderful resource right now that programs may want to take advantage of during this time. And then it gives information on how to properly serve meals. No buffet or family style is approved at this time, so there's some ideas about serving meals. And then the next is nap time, and so this we have some resources about when you should wash the bedding, also maintaining social distancing by setting up mats or cots, and then also when you remove the face coverings at nap time to ensure that the children can breathe freely. Then we go into outdoor time, and I think there's some really wonderful resources in here. Also, the same as with the playtime, there's resources to show you how ideas of activities that will really help you maintain the social distancing during outdoor activities. And then also it really just talking about increasing outdoor time, because we know that's a good way. Being outdoors, the virus doesn't spread as easily. So we encourage you to take your children outdoors as much as possible. And then the guide goes through some pickup resources and technical assistance information. So about staggering pickup times, what to do when parents arrive, and then also those check-in and check-out procedures. And then the last piece of the guide goes over closing. So the end of the day procedures, when to clean and disinfect, and how to make sure those toys and equipment is ready for the next day of care. And communicating with families is such an important piece of this. So we want to make sure that programs are in constant communication with families about the current guidelines that they're having to adhere to, and also just on supporting the health and well-being of families as well. So that's how we set up the guide. That's just a very broad overview of what the guide looks like. But like I said, make sure that you go on and really click on all of those links, because it provides really wonderful information. But today we really wanted to spend the majority of the time trying to answer questions that you guys had based on what's provided in the guide. And so I think now we're going to go ahead and answer some of your questions that came in beforehand. And there's still the opportunity for you to put additional questions in. And but I think, Christina, you're going to take it from here.
Yes, thank you very much, Karen. We received quite a few questions, so we'll start going through these. And then, as Karen said, as we have time at the end, we'll answer more of the questions that you're sharing right now through the questions box. First question here is around allowing parents to come inside the classrooms, or prospective parents taking a tour. So a question was around, we always have morning circle time where parents come in. We know that's not allowed. Can we have some parents come in, one parent come in a day? What are the guidelines around visitors into the classrooms?
And I can take that one, Christina. At this time, we are recommending that there are no outside visitors to any childcare facility. And this is really in order to reduce the risk to staff and children for the spread of the virus. So, you know, as much as to the extent possible, you can limit any outside visitors. So one thing may be, if you have somebody who wants to do a tour of your facility, you do that outside of childcare hours when there aren't families and children at your facility, that you would do that, you know, just one-on-one with the parent touring the facility. But we're definitely recommending no outside visitors at this time.
Thanks, Karen. Next question, will there be another state fund to help families and first responders, like the Emergency Child Care Collaborative that was set up from March through May?
So I can answer this as well. The Emergency Child Care Collaborative was successful, and we are very grateful that our state was able to provide that assistance during the beginning of the pandemic. At this time, there are not plans to offer the program again, but there are going to be other financial resources offered and funding opportunities, and CDHS will send out information on these additional opportunities as they become available.
Thanks, Karen. Someone just shared that they, just to jump back to that first question around visitors, that they've used virtual tours for prospective parents, and that has been successful with new families. So just a suggestion from someone listening. Thank you. And
that's a wonderful idea. Anytime you can do any of the visits that you would normally have people coming into the center, and you can actually set those up virtually, I would say we would support that.
Awesome. All right, the next question is around, this person says that we are a licensed preschool that serves ages 3 to 5. So they're wondering about what guidance they should be following. Is that the child care guidance? They're not a public school. How do they make decisions, or what set of guidelines should they be following?
Yes, and so preschools are actually considered child care centers, and they're actually licensed under the same rule set as a child care center, and so they follow those same guidance that we give for child care centers. So everything that pertains to the center would have pertained to your private preschool program.
Thanks, Karen.
Sure.
Next question, can you provide guidance to childcare providers on what to do when they have a confirmed COVID-19 case, whether that's their staff, a child, or a parent? Is there a set time frame they need to close? Do they need to see doctor's notes for people to come back? Can you share some more guidance on what to do in that situation?
Yeah, thank you, Christina. I can answer this one. This is Amy. If the current order right now does require a minimum of a 24-hour closure in the event that there is a positive case in a facility, it is really important, though, that you work with your local health department in these situations, because each situation is going to vary depending on the circumstances as far as whether or not the entire center would close, or it's possible that it could be a certain portion. And then it is possible that there could be an increased length of time, but that's why it's really important to work with your local public health agency.
Thanks, Amy. Sort of tied to that, I'm concerned about the wait times that it takes for people if they have symptoms and then get tested for COVID, for those test results to come back, sometimes 5 to 7 day waiting period. Do you have any recommendations on that?
Yeah, this is a really great question. So if someone has symptoms of COVID, testing is recommended. However, it's important to understand that the guidelines for isolation do have to be followed. And there are certain criteria that does have to be met during isolation and when they would be able to return. And for the first criteria is that they can't have had a fever for at least 72 hours and other symptoms have improved. And then it also has to be at least 10 days have passed since their symptoms first appeared.
All right, thank you, Amy. Next person wrote a question in that they direct an after-school program, and are there guidelines specific to after-school care, especially in light of children being in separate grade groups all day? And Karen, I think that was a question for you.
Sorry about that. I forgot I put myself on mute, so sorry everybody. I answered the question, but you all didn't hear me. So building-based school age programs fall under the guidance for child care centers. And so it's the same guidance for child care centers, preschools, and school age building-based programs.
Awesome, thanks, Karen.
You're welcome. I'll try not to mute again.
Perfect. The next question, why is it taking a while to provide guidance for schools and childcare programs looking towards the next school year? So what does that time frame look like? If schools have to shut down, will the state be reaching out to license programs? How do we think about a school year coming up and the impacts on childcare?
Yeah, so this is definitely a top priority for the department, and we are working along with CDE, the governor's office, school district representatives, and other community partners on this response through our Early Care and Education Network. It's one of the goals of the network. And so we will have a much clearer picture of this effort as school districts finalize their plans for fall. So we will continue to communicate information regarding this as it comes available. But I just want to ensure to everybody that this is a top priority. And, you know, I think school districts are now finally trying to have their final plans in place for fall. And so we will be communicating more on this really shortly here.
Awesome, thanks, Karen.
You're welcome.
The next set of questions are around group size. There were quite a few questions that came in about are we able to allow intermixing of groups or children at the beginning of the day or at the end of the day? When will these guidance change? What can we expect around that?
Yeah, so currently the public health order is really recommending that the children are in consistent, stable groups throughout the day to the extent possible. Now, we know there could be some extenuating circumstances, and we would suggest that in those cases, you reach out to your local public health agency or health partner and work through those, specific circumstances. But to the extent possible, we really would like consistent, stable groups throughout the day. And this applies right now to the entire day. We understand that this is a financial impact on programs, and we just want to say that, the public health orders are based on decisions that impact the children's and staff's health. And so if the public health order is updated, we will absolutely, make sure that we get that information out. And, I know that the orders are based upon the number of coronavirus cases, the amount of ICU hospital beds available in each county, and then the amount of testing being conducted. So, this is information that's relevant as of today. Things are constantly changing, and we know programs are trying to do their best. So that's what we would say. Please try to do your best. We want consistent, stable groups throughout the day, but if you have specific situations that you feel like apply to you, please reach out to your local health agency, and they can help work through that with you.
Thanks, Karen. I think similar to that question, something specifically came in around before and after school childcare for elementary students along with preschool. And do we need to keep elementary students separate from preschool students? Any guidance around that?
This is Amy. I can go ahead and take that one. So we do recognize that before and after school programs present a unique challenge. And I apologize that I don't have an answer for this today at the time of this recording, but it is currently being discussed and there will be more guidelines to follow.
Sounds great. Thanks, Amy. Next question here is around hand sanitizer. So under normal circumstances, preschool cannot use hand sanitizer. Has that changed? What if soap and water is not available?
This is a great question. The requirements for hand sanitizer have not changed. It has always been allowed to be used when there's no access to running water and soap, as long as the children are ages 3 and older. And I realize that a lot of people are wanting to use it as an extra precaution, and that is okay, but hand sanitizer can only be used in addition to hand washing, but not in place of when there is access to hand washing facilities. And children must always be supervised when using hand sanitizers, and then they also always need to be stored and accessible to children. One thing that I do want to draw everyone's attention to is there have been some issues and adverse health effects to the increased use of hand sanitizer, and there have been some recalls of certain hand sanitizers. So I will go ahead and put a link in the chat box to the information about that. And then we are also requesting a communication to be sent to all childcare providers regarding this information.
Awesome. Thanks, Amy. That'll be great to share that information with everyone here. The next few questions are around drop-off and transportation and things like that. So first question here is, how do we have parents sign in and sign out their children without sharing paper or writing materials? Do we have any suggestions on how to make that process go smoothly?
Yeah, so the good thing, there is guidance in the document about drop-off and pickup procedures and staggering drop-off and pickup times, curbside check-in and check-out, and using separate entrances. But staff can sign in the children in and out and then have parents verify their children's attendance weekly through email, or programs can provide individual folders with sign in, sign out sheets for each child in their cubby, or the parents can, I know a lot of programs are having parents bring their own pins so that they don't have to share with others, but there's some good guidance in the document regarding solutions for this.
Perfect. Okay, next question around this is around buses and transportation. So can school district preschools continue to use their district's bus service? Are there guidelines for transportation and vans and buses? Does that look the same for before school and after school programs? And then the last part around, do we recommend curbside drop off for children coming on buses? So can someone answer all kinds of transportation questions?
Sure, I can take that. So the guidelines for reopening schools is in process and it will include transportation. So at this point, we would advise everyone to check back in on the website. It's COVID-19.colorado.gov for that updated guidance, and transportation will be allowed. There will certainly be some guidelines though around doing it safely, and at this point, to the best of my knowledge, the curbside drop off is what is going to still be recommended.
Great, thanks, Amy. The next two questions here are around temperature checks and screening. So can temperature checks be done by the parents prior to drop off, or do the providers themselves need to check temperatures at the door?
Another really great question, and the answer to this is yes. Parents can complete the temperature check and screenings at home. It would be important though that the providers are verifying this when the child is dropped off.
Great. A question tied to that, I think, are providers required to track child and employee health screenings?
Yes, this is required, and there is a sample form available at that same website that I mentioned, covid19.colorado.gov, and the sample that's on there can be used for both staff and children.
Great. Okay, the next set of questions here is around playtime and activities to do with children. So a lot of questions came in around social distancing. How do we do this with kids? How do we keep them a certain distance apart? Do we know when this will go back to normal capacity? And until then, what strategies or suggestions do we have for promoting social distancing with kids?
Yeah, so the great news is that childcare facilities were allowed to return to normal capacity and group size. And so they need to, again, keep consistent, stable groups throughout the day. But there's a lot of information that we put in this guide and included many activity ideas for social distancing. And we know this is challenging. And so, you know, we are hoping programs to the extent possible are doing this. And we see it every day that they are. So we appreciate that, but we know it's challenging. That's why we included many activity ideas for social distancing throughout the guide. So please review the links. And then if you have any further questions, feel free to reach out to your licensing representative.
All right, thanks, Karen. A couple more specific questions about activities. Can students use outdoor sandboxes, and why or why not?
Sandboxes, given the traditional type of sandbox, they do not promote the activity of physical distancing, and so they are not recommended at this time.
All right. What about area rugs? Are area rugs okay to have inside a classroom?
Yes, those would be fine. We would just want to make sure that they're clean and good repair and that they're being vacuumed regularly.
Great. Another question, can we rotate wood or natural materials into the classroom? So different days bring in different materials. That way children can have some access to non-plastics, but it'd be a full week in between uses.
So at this time, the only materials that should be used are ones that can be easily cleaned and disinfected. Some of those materials are easily cleanable, and so that would be the question that I would ask you to assess, and if they are, then that would be okay to use.
Great. And then several questions about allowing for soft blankets or soft clothes, so can for baby clothing or baby blankets, other types of soft materials. Are those allowed? And is there a laundering schedule if they are allowed?
If they can be easily cleanable, they are allowed, although I would try to limit the soft items more to less than what you would normally have. And then with laundering, it would probably be a good idea to launder those every day.
Great. Thanks, Amy. All right, the next set of questions here are about masks. We had quite a few questions come in about using masks and when and how. So the first question, are masks required for all staff and for children? Is that a recommendation or a requirement?
Okay. So as far as masks, they are required for staff unless wearing one affects their health. As far as for children, masks are recommended for those children that are ages 3 and older with close supervision of children that are 3 to 5. And then no children should ever wear, or no child should wear a mask when they're sleeping. Now, because it's a recommendation, I think it's important to assess the appropriateness for each child, and it may not be a good fit for some children if you find that the sensation of having the mask on their face is upsetting to them, or you find that certain children are touching their face more because of the mask, then it wouldn't be appropriate for that particular child.
Great, thanks, Amy. I think that cleared up a lot of the questions that we've seen coming in here. Another question we've received several times is what about using clear face shields instead of masks? Is that acceptable?
Yeah, this is definitely a frequently asked question that we have been getting as well. And the face shields are not a substitution for masks. It's important to understand that masks need to not only fit over the nose and the mouth, but they should be snug and also on the sides of the face. So the face shields alone is not as effective. I apologize. We have seen some masks that have a clear piece that covers the mouth, and so it's something that you may want to look into, but I will caution people that we have not heard great feedback about them because of their tendency to fog up. So if you are considering using the more traditional mask that has the clear piece, we just recommend that you try it first to make sure it works well for you before making a large investment.
Great. Thanks, Amy. And I think you sort of answered this, but just to make sure, the question is around masks outside. So children 3 and up and staff, do they need to wear masks if they're outside?
Yeah, this is an area that we definitely want you to have some professional judgment around. If children are outside and they're doing strenuous activities, but they're able to maintain physical distancing, then it would be okay to have them remove their masks. And then we also understand that it is reasonable for staff to need to take a break from wearing their mask. And so if they are outside and maintaining that physical distancing, then this would be the best time to take a break from wearing it.
Awesome. A next question, can parents provide a mask for their students attending preschool?
Yes, they absolutely can. It could be something that would be provided by the facility or the parents.
Okay. And then I think you've answered this one, but just anything else you want to clarify with social distancing and children wearing masks, we know it's really challenging. I think you've said some of the rationale behind it, and do we know how long that order will be in place?
So aside from excluding people who are ill, wearing masks and keeping distance is the most effective way to prevent the spread of the virus. Now, realistically, we do understand that this can be challenging, especially with certain age groups, and we're asking people to do the best that they can. And then as more information is being learned about the virus, guidelines will be updated as necessary. I don't have a particular timeline as far as when that will happen, but it is something that is on our radar as we learn more.
Awesome. And then one more question around masks here. Once a group of children are in their classroom and the door is closed, is it okay to have the children and the teachers remove their masks at that point while they're in their cohort, and then put masks on when they go back into common areas?
So this would actually not be an okay practice. Masks are required to be worn by the staff, and then I've talked about this a little bit, but as far as masks being recommended for children, and so again, I think for them it goes back to doing that individual assessment of how appropriate it is for that child and whether or not it should be worn.
Great. Okay, and then a couple other questions here. Can students who are studying for their early childhood education degree at a local university come in and do their lab work during this time?
Yeah, so this would be, I kind of answered this before. At this time, we are not recommending any outside visitors to childcare facilities, really in order to protect the staff and children within those facilities and reduce the risk to the spread of the virus.
Thanks, Karen. And I've seen quite a few questions come in just to expand on that a little bit about guests coming in. And does that include early intervention providers or coaches or nurse consultants or music teachers, programming, things like that, visitors that might come in and do those types of programs? If there's a way to remain socially distant and still have people come in, are there any different recommendations around that?
The only visitors we're suggesting right now are critical essential personnel. And so at this time, we are not recommending outside visitors. You know, like this guidance is current as of today. As things that, you know, Amy alluded to this as well, as things change and we learn more about the virus and we see how, you know, the spread is going, there could be changes to this guidance, but at this time, we are not recommending any outside visitors.
All right, great. Thanks, Karen. And then Marianne, a question for you here. Can you talk about how often ratings for childcare providers are happening and how those ratings are tied to CCAP reimbursements right now if ratings cannot occur?
Yeah, thanks, Christina. I'll take that one. We will very shortly have an opportunity to re-engage in high quality ratings. As you all know, we have put a pause on that because in the past it's been very observation driven, and we're not even getting back yet to doing routine licensing and inspections. But we are modifying that process and working through a virtual process. And we're very close. So we're going to roll out a pilot in August. And we're going to make sure that those who are already in the queue to be rated are our first priority. So if you're scheduled, you will be first in line to get rated. But I would encourage anyone who is thinking they're going to be ready even in the next several months to apply now and get in the queue. The application process is still open and available online. And due to the nature of time, we are going to be holding separate town halls or outreach opportunities regarding this specifically. So stay tuned, we're close. I know it's frustrating, but these are unprecedented times. Maybe one of the silver linings to a pandemic is that we will be able to streamline this rating process so folks can get rated sooner, quicker, etc. So thank you.
Thanks, Marianne.
Christina, this is Karen, and I just wanted to clarify one thing. And Amy, please, correct me if I'm speaking out of turn, but I believe that if there are children and they need like services like physical therapy or OT or PT, that those clinical practitioners can come in and provide those services. Is that correct?
Yes, that is correct.
Okay, I just wanted to clarify that because I think in that whole answering of the question of who's allowed as visitors, they would be considered critical and essential visitors.
Thanks for clarifying that, Karen. I think there were a lot of questions around that coming in right now, so that's very
Yes,
helpful.
you're welcome.
Let me pause here. We've gotten through most of the questions that were submitted ahead of time, and I want to open it up to our panel experts and see if there's anything else that you want to add at this time, and then we'll start looking at the questions that have come in during the town hall. So, Katie, Taryn, Amy, Karen, anything else you want to add right now?
This is Katie. I just wanted to add into that the visits and not being on site for all the ECE providers out there. The CCHCs have been given some great guidance, temporary guidance on how to do a visit virtually and get our programs taken care of in that way, just so everyone's aware. And so we're prepared to take care of our programs across Colorado in that way and support this, what's in place. So I just wanted to add that.
And Katie, I'm going to just clarify, so in case there's people who don't know the acronym, they're child care health consultant.
Thanks, Karen.
You're welcome.
Great. Anything else from our experts you want to share before we jump into more questions? Okay. So a couple questions that have come in. One, I think to keep on going with that nurse consultant question, what are the guidelines for virtual nurse consultant visits? Can someone just talk a little bit about what that looks like? So Taryn or Katie, do you want to just expand on that a little bit more?
Sure, this is Katie. The way that we have asked our child care health consultants across the state to approach it is to meet the requirement of that monthly consultation visit. And so they would be supporting their programs with all the health and safety topics they typically would. And there's also guidance temporarily in place during COVID to be able to take care of our programs with trainings and even the medication delegations, et cetera. And so that is all in place right now, and we have documents and ourselves to support the child care health consultants across the state with this.
Wonderful. a little bit further on that one, a question about monthly drills and regular requirements for providers. Are those still expected for providers to be doing their monthly drills?
Yes, so this is Karen, and yes, all of your emergency drills you should still be doing. Now we know that creates a, situation where it's not great for physical distancing, but unfortunately, as we've already seen, wildfires don't stop during the pandemic, floods don't stop, like those kind of things can still happen. So we absolutely still want you doing all of your drills with your children, and then just try as best as you can to maintain that physical distancing as much as you can.
Thank you, Karen.
You're welcome.
A couple of questions have come in just to clarify around guidelines for preschool programs that are within school districts. Are they following the child care guidelines, or do they follow their school district? So can someone clarify that?
So for us, they're considered childcare centers, and they would fall under the same guidelines as all childcare facilities, but they definitely need to be checking with their school districts on what their policies are for operation.
Great. Another question here around field trips and activities. If it's possible to maintain social distancing, whether that's on the buses or transportation, and then at a field trip somewhere, is it allowed to take field trips?
We are not recommending that programs do field trip excursions at this time, because it is very hard to physically distance during transportation. Certainly programs, are doing some walking excursions, and those, as long as they can do the physical distancing, but we are not recommending. Most of the places that typically childcare facilities go to are still closed. So that's the other thing is, you would want to make sure if you're visiting any place that they actually are allowed and open and operating. So we're not recommending them.
Thank you, Karen. Several questions have come in just about accessing materials, whether that's disinfecting materials, bleach, PPE, so the protective equipment, or masks, and that and understanding that it's still tough to get those across the state. Does anyone have any suggestions around how to access those types of materials?
This is Amy. I know in the beginning we were recommending that people contact their early childhood council for those supplies. Karen, I don't know if you have any updates about that.
Yeah, I think that's a great place to start, to see if they have any information locally where they can send them for, those kind of resources. So I would definitely say, yes, it's still appropriate to reach out to your early childhood council. Also, your local public health agency may have additional information as well. I know some of the public health agencies have in the past provided some great resources around where to find supplies as well.
All right.
Thanks.
Another question came in specifically around nap time and mats. So if someone can clarify that 6 feet, is it 6 feet between mats, or is it 6 feet from head to head if you're switching and alternating those, the direction for the mats? So can someone give a little more description around nap time with mats?
Sure, this is Amy. To the extent possible, the mats or cots should be placed 6 feet apart. If that's not possible, doing the maximum distance that you can, and then rotating head to foot, it helps as well as far as increasing that distance.
Great. Another question came in around job postings. So some folks are saying that they're losing staff who are not comfortable or can't come into the classrooms, and then some staff are looking for other places while their centers might be closed down. Taryn or Katie, do you want to share about the job board and any other information about that?
Yeah, I can share. This is Taryn with Healthy Childcare. And we have partnered with the Office of Early Childhood to make some changes to our job board. If you go to the healthychildcareco.org website, you'll see that we have a job board there. So it's a public facing job board that anyone can go and look at to find positions that are available. And if you'd like to post a position, you just create an account on our website, which is free. And then you can submit your job to be posted. And we usually get those posted within 24 hours.
Awesome, thank you. Another question here, around trainings and certifications. A question about standard precautions was answered, but what about first aid and CPR classes? Is there an extension for getting those, or what is the recommendation for accessing those types of certifications?
Yeah, so some of those actually, we've had quite a few that have reached out, and now like CPR and first aid, that they're, when the safer at home orders got lifted and now that the restrictions are a little bit less stringent, we do have many that are going to where they're doing small group with social distancing in person trainings for the piece that has to be hands-on. So there are opportunities for that, but the department did grant extensions to those trainings. And so there's information on our website about the extensions to both medication administration, first aid and CPR, and health evaluations were the ones that we granted extensions to.
And I'll also just add, Karen, that if folks are looking for scheduled trainings, you can go to the Healthy Childcare Colorado website, and we do have a training calendar on there that many trainers post their CPR and first aid and medication administration trainings on.
Thank you, Taryn.
All right, another question we've seen come in a few different ways, but with the masks and our educators wearing masks, there's concerns around children's social and emotional development, facial expressions, things like that. I did want to note that in the guide, there are a few links to how to have conversations with children around wearing masks and what that means, some games and things like that you can play, and hopefully helping children to feel more comfortable around masks. But just wanted to open that up to our panel here to see if you have any other resources or things you want to share around supporting children's social and emotional development during this time.
Well, I would agree with you, Christina. There is really good information in the guide about resources to helping children adjust to the mask and talking to them about wearing the mask. There's actually a few different resources in the guide that can help with that. But it's important also, I would say engage with your families as well, and hopefully between the family and your programs, really trying to help support those children with wearing the masks.
Awesome. Thanks, Karen. All right, well, we are nearing the end of our time here. I will note that a lot of questions came in, and I know we didn't get to all of them. We'll have some contact information up here in a few minutes if your questions weren't answered, but also would encourage folks to reach out to their local public health, their early childhood councils, or their licensing specialists with additional questions. And we'll keep updating the Office of Early Childhood's frequently asked questions as we go through the questions today that we weren't able to answer. So I'll pass it back to Marianne here in 1 minute, but just want to open it back up to our panel to see if there's anything else you want to add before we pass it to Marianne to wrap up.
This
Well,
is Amy. I just want to say thank you to everyone. We recognize that this has been an extremely difficult time, and we do believe that people are doing a very good job with this. So thank you.
Yeah, and I 100% agree with Amy. That's exactly what I was going to say, how much we appreciate all the great stuff that you guys are doing out there to support the families and the children.
All right. So I echo those sentiments completely. We're getting a thunderstorm here. I don't know if you heard that. So thank you for all the great questions today. We do know you're doing your best to be safe and provide a very necessary service, essential service. And we are committed to continuing to share information with you as it becomes available through a lot of different communication tools, our emails, our newsletters. We will continue to do webinars. We intend to update the guide as well as new information is made available or that when the guidance changes. You can always find the most recent guide on the Office of Early Childhood's website, which is coloradoofficeoferlychildhood.com. And it's linked under the COVID-19 resources page, which you can see on the screen. We also encourage you to reach out to any of the experts you heard from today by using the contact information on the screen. We will share these slides, as we always do, with you following this town hall, so you can reach out at any time. And finally, we know you are working extremely hard to provide the best possible care for our children and families. And I just wanted to echo how grateful I am for your dedication and ensuring that our children and communities are healthy. Colorado is a leader in this space, and it's because of each and every one of you on this phone, on this webinar today. So thank you again for your time, and I hope you all have a good evening.